The ministers actually set out 4 tests for moving between the stages, and I'd just like to lay out the data behind each of these tests. First slide, please. So the first test was that the vaccine deployment programme continues successfully. And I think it's very clear to everybody in the UK that this has been very successful. A steady rollout for people for their first vaccination. So we now have just over 2/3 of people have had a first vaccine in terms of adults, and just over 1/3 of adults have had a second vaccine already, starting with the most vulnerable. And this continues thanks to the extraordinary efforts of the NHS. Next slide, please. The second test was that evidence continues to show that vaccines are sufficiently effective at reducing hospitalizations and deaths in those vaccinated. Is that a substantial proportion of the people who catch COVID, and some of whom will get significant long-term problems themselves, but also who transmit COVID, have not yet been vaccinated. This tells us a very positive thing, that a lot of protection to those who are most vulnerable, but additionally it makes clear why it is that if we go too fast at this stage when things have gone so well thanks to the efforts of the entire population, that there is a risk of significant spread amongst those in the younger age groups. Next slide, please. The third test is that infection rates do not risk a surge in hospitalisations that would put unsustainable pressure on the NHS. And as the Prime Minister has said, the view of all the Chief Medical Officers for England, Scotland, Wales and Northern Ireland, and of the Medical Director of the NHS, based on advice from JBC, is not only that rates in hospital are very low, which we can see in this graph, showing there's been a steady decline and the number of people who've dying from COVID is now very small indeed, thankfully, in the UK, but that we do not think there is a likelihood in the next period after this upsurge of seeing a significant increase in pressure on the NHS, although some increase in transmission should be assumed as a result of the opening up that the Prime Minister has laid out. Next slide, please. The final test, and in a way the most difficult test, is the assessment of the risk from variants of concern. These are new variants of COVID, which might be one or other or both of either more transmissible than existing ones, and everyone in the country will remember that when the B117 variant first started emerging in Kent, it then spread incredibly fast, so more transmissible ones are potentially a problem, or ones which could cause problems with vaccination. And we do have some confidence that the vaccines we have provides a reasonable degree of protection from severe disease, but that can be reduced with some of the existing variants, including the one B1351, first described in South Africa, but others could emerge, or we might get more transmissible ones, and we have a concern at the moment about a variant called B1617.2, rather snappy name, first described from India, and this is actually spreading from very small amounts, but it is beginning to spread in certain parts of the country, and we need to keep quite a close eye on this. So the point about this is the threats are significantly reduced, but there are still some residual issues that we need to keep a very close eye on, and therefore we need to go carefully and steadily, as the Prime Minister has said.